Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, registered nurse and PhD, and this show is dedicated to you, the healthcare consumer. And today we are going to be talking about the work of Elisabeth Kubler-Ross. Many of you have heard of her work about the 5 stages of grief. And let me remind you of what those stages are: denial, anger, bargaining, depression, and acceptance. Now, if you have heard about this work before, you know that when she started out, it was really about death and dying. But she quickly learned from her work, as it was applied to many different situations, that it really had more application around loss, not just death and dying. So loss of a spouse, loss of a job, loss of function, all of these things can be very devastating and really require a human being to go through these various psychological stages. And the way we're going to apply this work today is we're going to be talking with a guest who is returning with us today, Anita McGinn Natale. And if you've been watching our show, you know that Anita and her husband Clark have been very generous in sharing their story and their journey with devastating oral facial cancer. And our next show in this installment and in this series is really Anita's story, from caring spouse to healthcare advocate, a journey of recovering, giving back to society. So I want to welcome Anita again. Thank you for being with us today.
Thank you for having me, Nancy. It's nice to be here.
You're welcome. And the 3 areas that we're going to explore today in the discussion with Anita is the first would be how she really dealt with all those first stages, the denial, the anger, the bargaining. I mean, that is something that doesn't happen necessarily in a sequential way. You can move in and out and bounce around through these different areas, but how she had to call upon internal as well as external resources in order to really get through that. So she's going to recap some of those highlights of really how she moved through that. The second part is really going to be talking about reputable websites that she found, because often when you're the caregiver at home, you are isolated, and any of you that are in that situation really can identify with that. So she found the Oral Cancer Foundation website in particular very comforting, and she's going to talk about that and how, depending on your particular issue or problem, how you might be able to access similar websites. And then thirdly, and what we're going to spend the most time on, is really how she emerged from all of this. When she really moved into acceptance, she didn't not only accept the situation that she had at home, but she really then emerged as a leader and really became a volunteer in 2 very key areas that she will describe to us. And so that way she was really able to give back to society. And that's part of why she's on the show today. She's going to give back to us through sharing her story. So again, Anita, it's wonderful to see you again. And again, I can't thank you enough. You've really become such a great supporter of the launch of this show and such a great supporter of sharing your story. So let's begin with how you moved through some of those early stages of Dr. Kubler-Ross's work and how you really were able to put that all together.
I'd say the very first stage you described was denial. I think denial happened for me prior to my husband's diagnosis. We knew he was having a biopsy and they were going to be checking it. It would be a week, maybe 10 days before we would receive the results. And I do remember in those 10 days saying to myself, oh, it can't be, this can't be, it's got to be a mistake, it must be something else that he's having, it can't be anything that bad.
Right.
Once we got the diagnosis, we were so quickly swept up into the process of taking care of business at hand, doing whatever we needed to do to get rid of this cancer. I can't really say that there was much bargaining at that point. I think the bargaining happened a little bit later, when after the initial surgery, when my husband started having some complications, then there was some bargaining. You know, why does this have to be happening to him? He's such a good man. He's never done anything to hurt anybody.
Right.
Why is this happening to us? And there is no answer for that.
Right, I was just going to
There's
say
no
they're
answer.
normal questions for which there is no answer, but obviously it's very healthy to be asking those questions.
I think it is, if for nothing more than to just get those questions out and verbalize them. Because I think the more you internalize something, the worse off it is for yourself and for your loved one,
Right.
who's going through the actual process themselves. So, so let's see. That was denial, bargaining. What was the other one?
How about anger?
Oh, plenty of anger,
Plenty of-
sure. But I have to say, I did not share much of that anger with my husband. That anger was purely, I probably just experienced that alone, privately. And the anger was sort of spread out over many, many months. And sometimes it would be anger at the whole process, and other times it would be anger at this one thing in the process. But as I said, I kept it pretty hidden from my husband because I didn't want him to know that I was angry. I didn't want him to feel like I was angry at him. I wasn't angry at him.
Right.
I was angry at the situation. You know, why do we have to deal with this?
Right. Did you talk to anyone about that anger? I mean, part of, again, when people feel angry, often they feel guilty, you know, that they shouldn't be angry.
Oh, that's a good point.
That, you know, maybe they're not rising to the occasion, but I mean, part of what we're trying to instill in our listening audience is that these are very natural stages, they are very important to go through, and we don't want people to feel guilty. So how did you deal with some of that? I mean, did you talk to people? How did you channel that anger?
I definitely felt guilt, a lot of guilt, over feeling angry and disappointed. You know, disappointment is another big one. Disappointed that the things that you had hoped for yourself and your husband are not going to happen the way you anticipated them happening. So, but those are very tough feelings to talk to anybody about. So this is where I spent some time by myself when my husband would be asleep at night or in the afternoons, when I went online and started looking for some information and some camaraderie or some sort of common ground with other people that may have been going through something similar. And I found quite a few websites. The one that helped me the most was the Oral Cancer Foundation. And that they had a forum for caregivers, patients, family members, and it was on that forum that I received the most help and support. And I remember my very first post was quite long and lengthy because I was giving the setup of who we are and what's going on. And I couldn't believe how many people responded and welcomed me and vent away. We're here, it's a safe place. And it was a very safe place to share some of my deepest, darkest fears.
Right.
And guilt.
I think that I'd like to underscore that point that Anita just made, and that is anger is a very normal and natural emotion under many different circumstances. But in this particular circumstance, what Anita did was she channeled her anger. You know, it motivated her to find some outlet. She didn't know what to do with it maybe at first, and she didn't want to share it with her husband because she didn't want to make him feel any more miserable than he may have been already feeling anyway. And she did not necessarily have someone she could necessarily call up in the middle of the night. So I think finding this website was a very healthy way of channeling your anger. So tell us more about what you found there. I mean, how did it really help you?
There was a community of people who have either been or they are currently oral cancer patients, were oral cancer patients and in recovery, or they're caregivers to an oral cancer patient. And they have seen exactly what I've seen. It was amazing how common, well, the common ground was on our feelings and emotions when different oral cancers can present differently. So some people are dealing with an oral cancer in their throat, you know, base of the tongue, which is here. Others might have it in their nasal passages or in their sinuses, but all of these head and neck cancers have a similar course in that they arouse lots of fear and guilt and the unknown, fear of the unknown. What can we expect? So I've received so much encouragement and pats on the back, and you're doing a good job, because you doubt yourself when you're in your darkest moments of caring for someone who's so critically ill. It's easy to doubt what you're doing, and is what I'm doing effective? Is this
Right.
going to make a difference in
Right.
his life?
Right.
So it was great to have people behind me saying, yes, everything you're doing is great, keep doing that, and then giving suggestions for how to handle a situation that might come up. And slowly, as I was receiving information, I then became one who started giving information, which was a very nice shift. So someone might write in something that I knew about, that I had experienced on my own and with my husband, and I could then write and say, let me encourage you, let me tell you what I did. This helped me doing it this way. It was really fun to see that shift, because I no longer felt like helpless. I was now helping.
Right.
It was great.
Right. So I think that what Anita is, again, recapping is not only did she find a new channel for her anger to get support, encouragement, but you also are telling us that you got some real actual information and some real tactics, things that you could do as the primary caregiver that really helped you do a better job.
I did. In fact, I would say to anybody going through a critical illness as a caregiver, I would highly recommend that you search the website for information, but you have to be careful. You've got to know that and be aware that not all websites are reputable. So it's important that you seek out information from sources that have a history of clinical and research-based information. Most illnesses, for example, there's say brain tumor, there's an organization for brain tumors, there's an organization for breast cancer, there's many, but you really can, most of them will have a forum that you can check into and follow and ask for help, and people are willing to give it.
Right.
So for each specific area, there's usually a website.
Right. Right. So I think that what Anita's saying is you've got to find websites for which there is this interactive opportunity. Some websites are just really one-dimensional. They'll give you information, but they don't necessarily have that dialogue opportunity. But for the major illnesses, it seems like there are many websites out there that really do offer that. And I'm just wondering, that anger piece, no doubt really had something to do with you feeling depressed at different times.
Oh, yes.
So in terms of depression being, again, one of the stages of Dr. Elizabeth Kubler-Ross's work, did you feel that depression lifted after you had this forum? Or did that play a role in really helping you with your own depression?
I think it helped me recognize that I was depressed.
That's important, Anita.
It's
very important.
Because, and then the next step was, I need to go to my doctor and describe what my feelings are to my doctor and see if she can help me, my family physician. And I did that. But I felt myself sort of sliding into a little bit of an abyss, sliding down deeper and not knowing how to get out of it. Mm-hmm. So I did recognize I was depressed, thankfully. I mean, I don't know what would have happened if I didn't recognize that. Maybe someone else would have. Mm-hmm. But I think it's easier when you can recognize it in yourself, because if someone's telling you you're depressed, that's kind of a tough pill to swallow. So I received some medication and did some cognitive therapy, and I would say about 2.5 months worth of cognitive therapy, working out some issues of my own that I couldn't share on the forum, or maybe didn't feel even aware that I could share.
Right.
I'm not even sure where I was at that point.
That's a really interesting dynamic, because depression is very normal. For those of you who are caregiving at home, what Anita is saying is that her depression was something that she didn't have anyone necessarily around her that was pointing that out to her. Through her own self-awareness and realizing through this website that other people were talking about their own depression and they were reflecting back that it is normal, that really helped her, again, to take action. It's one thing to have an issue and not to take action. It's another and much healthier to take some action. So by going to your family physician, getting some medication, getting some talking therapy to really reflect on your situation and realize that this is really hard, this is tough. You wouldn't be human if you didn't have this depression. I mean, this is just part of being a caring, feeling person.
Well, I think one of the nice things about this program, this whole series of programs, is to get out this exact point about depression. I still think that even though we see lots of commercials on TV about depression and that how you can go to your doctor and get it asked for this drug or whatever, I still think that depression is handled as a an embarrassment to most people.
A weakness.
A weakness, yes. And instead of recognizing that if you broke your arm, you would go to the doctor and
Right.
get it fixed. If you're mentally, emotionally feeling broken or somehow not up to where you used to be, then it's important that you get help.
Right.
And it's so fixable. That's
Right.
the other thing. It's so fixable. I hope that people will get that message that if you are feeling depressed, it's easy to take care of, and the person you need to speak with is your family doctor.
Right.
He or she is a partner in your health care.
Right. Well, I think Anita can only say it for her own experience, and I think no one could say it better. But that is an important point to stress, that it is normal, it's human, and it is treatable. And that part of it is all the good news. Feeling guilty or feeling that you're not a strong enough person or you should have been able to get over something like this is really unrealistic. And why? I mean, like you said, if you had other illnesses, you would be taking action. So I think you've really given us a great model with your own experience. Really, thank you for doing that. What do you think then moved you from sort of these parts of the journey to acceptance? I mean, I don't think anybody, has a drum roll for that. I mean, again, it's one of these processes that takes time. But can you think of any of those sort of highlights and markers?
I think my husband had been through so many roadblocks on the way to recovery, series of infections and hospitalizations and surgeries after the initial surgery, that I'm not saying it became expected, but it became less worrisome when he had a surgery or an issue would come up. I don't mean less worrisome. Let's see. Let me rephrase that. I think we handled it better. It became, we had this phrase, it is what it is, and we'll take care of it. If it's an infection, then we'll take care of it. Or if you need more surgery, it is what it is. I remember we would say at Clark, it is what it is. Like, you can't always change.
Yeah.
You can't wish
Right.
and hope something to go away. You've got to take care of it. So you get on this track where that's it. You're going to take care of it, no matter what comes along.
Right. I think that I like that, because what it really says to me just in listening to it is it's a note of optimism.
I think it is too. Actually, I do, and I consider myself an optimist, and I was Clark's cheerleader too. So while maybe I wasn't feeling 100%, I was always behind him, cheering him on. You can do it. You can get through this. When he would have his dark days, and so I think I'm always sort of looking at trying to find the optimistic, the bright side of things.
Right.
What's the positive? What can we take from this that's going to be positive?
Right.
What can we get out of it?
Well, I think that's good. And I think also I'd like to highlight, because this was emphasized in previous shows with Clark and Anita, they also had an excellent treatment team, and they had a lot of confidence in their full treatment team. So when you can say it is what it is, the other sort of hidden factor in that is that they knew that no matter what came up, that the people at the Hospital of the University of Pennsylvania would do an excellent job in handling it. So you really felt that partnership, right?
You're right, and that's a really good point, because if you don't have that confidence in your healthcare team, maybe I would not have had that. It is what it is. Maybe we would have been more worried or fearful of what's next. But we do, and still do, have tremendous confidence in the team that Clark has for his healthcare.
Right.
And knowing that they're not going to be surprised, they're not going to be frightened off by, oh my gosh, what's happening? They just take it in stride and, yeah, we can fix this. It was always the attitude that it can be fixed.
Right.
We can take care of this.
Right.
That's a wonderful feeling.
It is. I mean, it gives you incredible reassurance. I just want to also make note that there are many good people at many very good institutions. There's not just one place to go for anything. But I think that what Anita and Clark did was that they had a really good referral early on. They felt confidence right from the beginning. And part of what our show is trying to emphasize is how you can make similar decisions, so that when you get a devastating illness or anything that you need to deal with, you know how to ask the right questions. You know how to proceed, so that as you are making decisions about who your treatment team is going to be comprised of or where you're going to go, you would feel the same kind of confidence that Clark and Anita found in their treatment team. So that was the beginning of sort of accepting the inevitable, that this was a long-term illness. Again, I want to emphasize that the journey that Clark and Anita have gone through is over 5 years, and it was a lot of ups and downs. So to be able to sustain that and not to feel like it was all for naught, or maybe it wasn't going to work out, I think it's been part of why you were able to accept it. You just felt like you had this journey ahead of you and it was going to be successful.
And you don't know how long a journey like this is going to be when you're entering into it. All you see ahead of you is the next week or the next couple of days. You don't know, fortunately, I think, that it could be as long as it was. But that's probably a good thing because
Right.
I think
it could be too overwhelming.
It'd be overwhelming and maybe a little daunting because when I look back on it, many times we say to each other, "Can you believe we went through this over 5 years? Like, can you believe it was 5 years ago that you were diagnosed?" It seems like it went by in a flash for us.
Right, retrospectively.
Yes,
Right.
retrospectively, exactly.
Right.
Now going through it was very, very much every one of those 5 years.
Right. But I think that in our very hurried world, it is very reassuring to hear that sometimes you have to sustain this journey over time and that you can do that. And again, I think your point, denial is a good thing. I mean, denial and knowing that this was going to be 5 years could have been way too much to handle. And maybe your treatment team didn't know how long it was going to be because they didn't know what kind of complications they were going to run into. So there's no perfect script for this. I mean, everyone's journey is going to be unique to their circumstance.
That's right. And I also think that when you're moving through something like this, you're constantly adjusting your response to things, constantly, whether it's your own fear or your spouse's fear or the unknown. You're constantly making adjustments, little adjustments here and there. And one of the largest adjustments we made after all of this was over, we used to enjoy going out to dinner periodically. We weren't big on going out to restaurants all the time, but we would go out. And we have since cut back on that quite a bit. Actually, we started going back a little bit more lately, but I have to say that it was a minor disappointment in the beginning. Well, I guess that part of our lives it will be forever changed, but that wasn't such a big deal. I mean, we found other ways to receive enjoyment during our daily lives, and it's been great. We feel very lucky that we have been able to find those moments and things to do that are enjoyable for both of us.
Right.
And don't require anything more than just being together.
Right. But I think what is remarkable and what we're going to move to next in this discussion is how Anita was able to migrate from simply accepting this whole journey to really moving to another stage where she became, I would call her a super volunteer in 2 areas that she's going to tell us about. The first is that she became an advisor and a volunteer advisor to a group of the Hospital of the University of Pennsylvania. And again, we did a whole other show on this, which I hope you can access on the website because it's really worth seeing a model of how people who have been through the experience can then give back to a hospital and help as a volunteer, not just be in, say, the gift shop or at the information desk where you typically see volunteers, but this is volunteerism at a whole different level where Anita will tell us how she is advising some of the leaders inside of the Hospital of the University of Pennsylvania on how they can make their product, their service, their outcomes even better. So just give us an overview of that again, Anita.
Well, I wanted to volunteer at the Hospital of the University of Pennsylvania, and I contacted the volunteer department, and during my interview, Donna had suggested that I might be a good candidate for the Patient and Family Advisory Council. Having been up at the hospital so much of our last 5 years, I really felt comfortable in that environment, and I thought this was a good thing to try. So this group is a group of patients, caregivers, and clinicians, and we meet together once a month, and we take on projects at the hospital. The goal is to make healthcare in that hospital, at HUP, more patient and family friendly. So we're trying to break down some barriers between the clinicians and the patients. Instead of having the physicians on one side and the patient on the other, we want to come together as more of a team,
Right.
that we're all in this together.
Mm-hmm.
And it's been a marvelous, a wonderful experience. We've taken on some very exciting projects. I'm looking forward to this fall because I'll be participating in the nursing orientation, which is there. I'll be giving, myself and another person will be giving our perspectives from caregiver and patient perspectives on certain things, certain ways that might be done a little differently with nursing.
Right. Well, I'm thrilled to hear
exciting.
that. I mean, as a nurse executive myself, I'm really happy to hear that Anita, I mean, who could do this better than Anita, be the voice of the patient, orienting new nurses and experienced nurses as well to the voice and the perception of the patient and the family. This is becoming much more important as we are really measuring patient satisfaction more and more in hospitals. I think that, you know, this will be definitely a step in the right direction. But I also now like to tell you like to tell our audience rather about what you're doing with the Oral Cancer Foundation, and maybe we can quickly show some of your paintings.
Sure. Well, I am an artist, and I wanted to help out a little bit more in volunteering with the Oral Cancer Foundation. I've attended a number of their walks, and some of these locations have raffles or silent auctions where there are items that the community members have donated, and I thought, well, this is something I could do. I could donate a painting. So I started out by donating one of my paintings to Susan Lauria's David Nasto walk up in northern New Jersey, and that went over very well. And since then, I've actually, to this day, I've donated 12 paintings.
Wonderful.
The ones, let's see, if we can show one of them, I'll tell you a little bit about this. One that's up on the screen now is called Leafy Green.
That's
and
beautiful.
Thank you. That is being donated, or has been donated, to Houston. Their walk is taking place October 12th of this year in memory of Nathan Hart, who was a member of the forum who had passed away from oral cancer, a delightful young man. And so I'm really excited that they're going to have that painting for their walk this October. And the next one is Showing Off 2. That was for the David Nasto walk for Susan Lauria. Her brother was a snowboarder, and I thought it would be fun to have a painting of a snowboarder just to kind of call a reminder to who he was and what he enjoyed doing. That walk is taking place on the 24th of September.
Okay, beautiful.
And then the last one is, this one's called Returning Home, and you'll see at the top there are some birds coming back down to the marsh. This one has a little bit more of a tie to oral cancer, a little subtle tie, in that one of the things that I remember Clark wanting so badly was to come home, return home from the hospital. So that's why that one has that title. That actually was auctioned off in April. San Antonio's walk was in April, I think it was April 12th of this past year.
Okay.
So those are 3 of the 12 that I've done. It's been a wonderful experience, and
Wow.
they're being very well received,
Right.
which is exciting.
Right. Well, I think that this is a beautiful illustration of using your time and your talent to
Thank
give
you.
back to other people, which is quite admirable. I mean, just to comment on, not only are they beautiful paintings, and you're obviously a very experienced and gifted artist, but they all have that journey feel to them.
Thank
You know,
you.
I think that, you know, they have a path, they have a mission. Even the snowboarder, you know, is
Right.
on a journey down that mountain. So I think that they're, again, uplifting themes. They fit very beautifully into the fundraising objectives of the Oral Cancer Foundation. And I think that what you're telling us is that you were able, in your acceptance, and this is what I think is really so remarkable about Anita, is that you've closed all the loops. Anita has not only helped her wonderful husband to recover, she has really helped herself by dealing and growing through her own experience, even mastering her own depression. But that she has closed the loop with the Hospital of the University of Pennsylvania, giving back to that wonderful institution in a very important way. And she has closed the loop with the Oral Cancer Foundation, which came to her rescue in her moment of need. I hope that this show will really have illustrated the incredible growth as a human being that we all might have the opportunity to experience. We never know when a very devastating illness may strike ourselves or our family or a best friend. And I think that having a show with someone who came as a regular person, did not know that this was going to be her assignment in life, and how she came through it so beautifully. I can't thank you enough again, Anita, for being with us. Is there any parting thing that you would like to say to our guests today?
I would just like to say that there is help out there. Don't be afraid to ask for it, and when people offer help to you, don't be afraid to accept it. I think that's what I learned to do. Accepting it sometimes is harder than asking for it.
Right.
When someone offers help.
Very good
That helped
advice.
me.
Very, very good advice.
Thank you so much for having me, Nancy.
You're welcome, Anita. It's been beyond a pleasure. It's been a gift for you to be with us and to impart your message to our audience. Thank you very much for joining us, and have a wonderful day. Please catch our shows again, and you can catch this one again at www.drnancyrn.com. Thank you. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.